Welcome to a Counseling Skills mini lecture. I'm Dr. Allen, and today we are going to be talking about reflections of feeling. Full transparency, I'm going to try to keep it mini, but I have a lot to say on this topic because there's so much to go over. But for this lecture, I'm going to be going over the skill and how to use reflection of feeling. I'll explain the differences between a thought and a feeling, and then I'll share some important considerations to have when using this skill. So there are several different reflecting skills and counseling techniques. Each skill has a different impact on the session. I like to imagine it as the layers of the earth. Using these skills brings us closer and closer and closer to that core of the client's presenting concern. Now, a paraphrase helps us understand the day-to-day experiences, facts and thoughts, and just generally what's going on in our clients' lives on the outside. Reflection of feeling takes us a step further down into the emotional experience of our client. And then using a reflection of meaning takes us even further towards the client's core values. As you practice each of these skills, I encourage you to pay attention to what it does to your session in that moment. Now let's start with how to use this skill, and then we'll dig into some of the considerations. Now, note that it is an advanced skill. It's hard to do, especially at first, but it's important to try early on so that you can get more comfortable and eventually it'll feel a lot more natural. So, what happens is you start by naming and identifying the client's feeling. Now, yes, this takes a great deal of listening beforehand to make sure that you have accurate empathy in understanding what the client might be going through. So, don't jump into this skill too quickly. It typically takes either several minutes within a session, or maybe even longer, or maybe even a couple sessions to really understand how a client might be feeling. You can also use some overt nonverbal cues, such as the client's facial expressions or even their body language. Now, the purpose of the skill is to bring awareness to the client's emotions regarding the issue or whatever is going on right now. We're not typically trained in emotions, just as humans. It's not a skill that many of us have been taught overtly. So sometimes our clients don't quite know how they are feeling in a moment. They might be knowing they're having a feeling, but they can't name it or don't do that automatically. And so this skill kind of provides us an opportunity to teach them, to show them that they're having a feeling and to put a label to it so that they can start identifying of, oh, when I'm feeling this way, it means this. And what this does is it helps increase a client's level of self-awareness. They start recognizing those internal feelings. Now, for those who might be recognizing it or not, what reflection of feeling does is it deepens disclosure. When a client feels heard and understood, it really allows them to open up more and disclose more of what's going on. You'll notice that it in the way that it impacts a session. Once you label a feeling, that might be when a client really starts to emote more. You might see them be actively angry or start crying because you've nailed it. You've identified what's going on internally for them. And so it's a really powerful skill, especially when you've done well. And then also checks perceptions. You might have an idea of how your client's feeling, but it might be kind of confusing. Maybe it's convoluted. They aren't upfront about it. And so you post this as a ponderance, as a wonder if they're feeling a certain way. And it allows you to check that perception to see, is this really accurate for the client's experience? So you can start off by using the simple formula for reflection of feeling. As you get more comfortable with it, you might find your own authentic way to do it. But for right now, try something like this. For then and there situations, you might try something like, it sounds like you felt blank when blank. So for example, it sounds like you felt sad when your friend left you out of the party. You can try the here and now as well. So I wonder if you feel angry right now as you tell me about your husband forgetting your birthday. Or maybe wonder if you feel angry right now as you tell me, as we try to schedule a session and it's not working out. I don't know. You can play around with it. There's several different situations and ways to use this skill. Now, there's also another layer to this when you're thinking about labeling an emotion, is you want to consider the intensity. There are low level or mild intensity emotions, and there are high level or intense emotions. And it is possible to over or undershoot that in that moment. Now, it's okay if it happens occasionally. It gives the client a chance to clarify. You might say something like, gosh, that really must have enraged you. And they're like, well, no, I was more annoyed by it, right? Two very different experiences. Now, you going back to making sure that you are being mindful and taking your time before doing a reflection of feeling, because doing it too often, getting it wrong too often, can possibly result in a rupture of rapport and shows a disconnect or low empathy between you and your client. So again, this is a skill that you use when you gather enough of that data over time in that situation. And you'll get faster with it with certain clients. And once you start seeing them longer, you get to know them a little bit better. But initially, especially in this, make sure you're taking that time to really figure it out. Okay. So feeling versus thought. This is my own little pet peeve. We often use thoughts and say that they're feelings. So I like this little image here. I feel like I'm supposed to say something, but I don't know what to say. That's not a feeling, that's a thought. Versus what it might actually be saying. So maybe I feel like well, if you say like before, it's probably a thought. So in that first image, it might be, I feel confused or I feel conflicted because because I want to say something, but I'm not sure what to say. And then I want you to make me feel like I'm the only squirrel in the world. I just find that funny. It might say, I want to feel important, or you want to feel important. So that's a hint. If you say like before, it's probably a thought. This is something you can start paying attention to now. Just even the way you talk in everyday language, we often say, I feel like blank, when in reality, I'm thinking blank. So start that process now. This is something to be mindful of in your own use of a reflection skill, but also start noticing your clients if they're doing it too. So it's important to start building a robust feeling word vocabulary to use in session. The more words you have, the more helpful you can be in helping clients be aware of their own emotions. Many of us grew up without the specific lessons on how to identify how we are feeling. So when we use that accurate reflection of feeling, we can teach clients how to label their own emotions. Now, be warned, frustration is often one feeling word that counselors in training like to use often. However, note that it's not very specific or a strong reflection. It's often misused and serves as a label to cover up more vulnerable emotions like hurt, abandoned, irritated, or confused. So keep your ears on if you hear a client say that they're frustrated. Really explore, is that really frustration? And then be mindful if you're using a reflection of feeling. If you want to use the term frustrated, is that an accurate label for that situation? Now, there are many, many tools that you can use to help increase your feelings vocabulary and that of your clients. There's feelings wheels, there's hundreds of them out there on the internet. This is one I use. Gottman also has a great one. There are feeling charts. This one in the middle, for example. I actually have this one on my fridge. And we have a little magnet, and our family members can put it on certain faces for how we're feeling. And then you can use a more standard feelings chart with many, many different feeling words labeled. So I recommend having some of these available yourself in session, both for you and for your client. Okay, so some important notes about feelings. A person can have more than one feeling at once, and they may seem conflicting, such as feeling both happy and sad, but that's completely normal. So, for example, if you have a friend who got their dream job, you might feel really happy for them, but the dream job is in another country and they have to move, therefore, leaving you feeling sad, maybe feeling grief that you're losing that proximity to your friend. Two feelings at once, both can be true, both are valid. Now, something really important when we start thinking about sitting with clients and their feelings, especially in feelings like sorrow, depression, sadness, you need to reflect on what is your own comfort level regarding sitting with someone who is crying. Many people feel uncomfortable, and their first instinct is to want to make the person feel better and to get them to stop crying. They might do this by letting up on that emotional topic or even by switching to a different topic completely. And that's something important to know about yourself because if you do that in session, you can accidentally, one, invalidate a client's feelings in that moment or rob them of a rich opportunity to experience catharsis and cry. And so pay attention to your own discomfort in that moment and try not to let yourself wiggle yourself or wiggle the client out of it. There are some exceptions that I'll talk about in a moment, but start with that self reflection first. And it's important to know that feelings are not permanent states of being, they fluctuate. Feelings don't last forever. And that's important both for ourselves and for our clients to remember. So, what if a client cries? Should you jump up and hand them tissues? That's a hotly debated topic in the counseling world, believe it or not. Yes, I do recommend having a tissue box. However, and I'm in this camp of belief, but I wouldn't jump right away to giving a client a tissue. I make sure they know where the box of tissues are so they can choose to do it if they want. But handing them a tissue to me signals, I want you to stop crying, right? Here's a tissue to wipe up your tears. I will instead let them sit in that feeling and just let them just be present for them. Now, if it gets messy or if they're clearly starting to come back up from that emotion and start to self-regulate, then I might, if the tissues are closer to me than them, then I might hand them the box. But otherwise, I just let them feel their emotions and choose when they want a tissue or not. Now, another big topic is the idea of empathic crying. So, some of us, myself included, have a really hard time not crying ourselves when we see someone else crying. I don't know, it's something about the red eyes and just like that intense connection, and I start to well up too. That can be helpful and or problematic depending on the situation. Now, again, something debated within the field. And best practice is that you do not cry in front of your client. You should never be emoting more than your client, especially when it comes to tears. A client should not feel like they have to take care of you. Now, it might be appropriate to allow yourself to be tearful, especially if there's really nothing else to say. I think, and I'm remembering just one session that I had, and I think the biggest one where I let myself cry was when a client had shared about a miscarriage. And there's just nothing else I could say or do in that moment. Nothing. Everyone else in their life had tried to cheer her up or have her not think about it, help distract her. But in that session, all she needed was just to feel that deep sense of grief and loss. And just become a mother myself in that time. Like, I just let myself sit there and feel it with her and had just like a lone tear go down my face, and we just felt it together. And after the fact, we processed what that moment was like for her, and she shared that it was really powerful to sit and just with someone who just let her feel that and who was feeling it too. So that is an example of when an empathic crying can be appropriate. Now, if you find that you're in a situation where you cannot regulate, that might be a time to step out for a moment. Uh, you want to balance that between rupturing a rapport or not, but you need to be mindful of your own self-regulation in those moments. All right. Other things you could do, notice and or talk about where feelings are felt in the body. So breathing, heart rate, muscle contraction or relaxation, heat, hot or cold sensations. Start bringing awareness to that. And so a client, again, can start tying sensations to feeling words. And then remember, awareness of our own emotions is a skill, and awareness of the emotions of others is a skill. So be kind. Oh, I forgot to share. I do have a tip when it comes to empathic crying. If you're trying not to cry when a client starts, it's look at the eyebrows. Like I said, when I see those red rimmed eyes, that's what gets me. So just shift your focus up a little bit, look at their eyebrows, notice the shape, notice the color, and that'll, for me at least, kind of helps bring myself back into my body but still looks like I'm maintaining eye contact with them. Pro tip. All right. Last little bit, as far as feelings, you want to find a balance between talking about feelings and thoughts. So I like this idea of a workout metaphor. For many people, going to the gym can be really daunting, right? Because they know it can be hard and they know it's going to hurt afterwards. It's going to feel sore. And that's usually one of the biggest hurdles to even getting to the gym. Therapy is really similar in that aspect. People know they should go, but they don't want to because they know it's probably going to hurt. And many clients are afraid of what will happen if they open up the dam and allow themselves to cry. That's one of the most common conversations I have in the first few sessions with clients is that they don't want to cry because they don't think they'll ever be able to stop. But what we know is that crying allows for catharsis and results in a release of emotions. Several research studies support the benefits of crying in this way. However, much like a workout turned into a burnout, where you can't lift your arms the next day, an entire session in deep sorrow can leave a client feeling raw with an emotional soreness that lingers for days, if not longer. So as therapists, we want to be helpful, find a helpful medium where we allow our clients to feel and to use our insight into knowing when they need to be led back to the surface. Much like a diver, you don't go all the way down and all the way up right at once. You want to find a healthy balance as you resurface. So times when you need to start thinking about bringing a client back up from those emotions, out of those emotions and into the present, is if a client's starting to show signs of an impending panic attack, like hyperventilation, dizziness, nausea, or intense fear. Or you want to bring them if they're dissociating, or when session is coming to an end. Now, while not always possible, it's generally considered best practice to get a client regulated before ending the session. So I like to keep my eye on the clock so that when we get to those last 15 minutes, I'll intentionally switch to content-based skills such as paraphrasing or questions so that we naturally start moving out of the feelings and into more content-based things. In those moments, I might start talking about skills or even just a little bit of small talk to kind of maybe about family or something that I know makes them feel good or happy or connected so that I can start helping them regulate. Well, that's it per questions. Not so many of a lecture. I'm sorry. Others will be shorter, but there's a lot as it relates to this skill. But if you have any questions, email me at Dr. Allen. Email me at lkallen@scu.edu, and I look forward to hearing from you. Take care.